Welcome to the Uzima Health and Wellness Podcast. What did the doctor say?
Wow, that's amazing. So, honestly speaking, what's the life expectancy of a patient with sickle cell anemia?
So, this is a tragedy in sickle cell disease. The average life expectancy is still about 50 to 60. And we really haven't budged much in the last 30 or 40 years.
That's right.
We've made amazing strides in pediatrics.
Yes.
So, the earliest large population studies that I can think of from the 1970s.
That's what I read.
About 75% of children surviving to adulthood, 75%. And now it's, above 95, 90, 96, 97% of children get to becoming adults. But that period from when you're 18 to 21 to the later adulthood, we still haven't been able to provide the same level of care to adults with sickle cell disease as we have to children with sickle cell disease. And it's really, really tragic.
Well, I think that we still have to face some of the social determinants of health, environment, education, and they become big influences that you, as well-intentioned as you are in all the research, can't ultimately control for every patient. That would be wonderful to be able to do that. But of course, those determinants that that conversation about COVID has brought out, I'm sure weighs in on your population as well.
It absolutely does. And it's kind of the perfect storm. The way that I think about sickle cell disease is sort of injury by 1,000 cuts. You have these injuries, these red blood cells that are taken on the abnormal shape. These cause these small injuries to your entire body over the course of life. So, when you're 6 months old, you don't really have a lot of injuries, but little injuries continue to happen. So that by the time you are 20 years old and these injuries have been happening for 20 years, now your body is starting to really feel the effects. So we know that sickle cell disease tends to be progressive.
Yes.
And at the same time as that disease starts to become more progressive, becomes more apparent, then the needs of our young adults change, and those social determinants of health become even more pressing. And I mean, it's really tragic. We learned many years ago that the average life expectancy, as I said, is 50 to 60. But there's actually a spike of mortality, a spike of in the rate of death in the mid-20s.
Oh, okay.
And it's that transition from pediatric care to adult care at the same time. Social determinants of health, young adults are transitioning to independence. Yes. And it's happening at the same time as the disease is starting to really get worse. I mean, it's a perfect storm, but as pediatricians and actually with our adult hematology partners, we're really leaning into this transitional period and really trying to focus on and using some research, but trying to focus on how can we provide better care in that to bridge that gap so that our children and young adults can really get into adulthood and continue to thrive as they've done as children.
Hi, Uzima family. If you like what you're seeing and what you're hearing, subscribe to our channel. Hit the bell icon below to be notified of our recent videos. What the doctor say?